Good day everyone, I'm Kim Huevos. I'm a third year student. Good day everyone, I'm Kim Huevos from Arellano University Jose Abad Santos Campus, third year, College of Nursing. So today, I will be showing how to do medical hand washing and surgical hand washing. So without further ado, let's get started. So first is medical hand washing. When it comes to medical hand washing, the first step that we will do is to assess our hands. If there are any kinds of cuts, lesions, abrasions, if there is heavy soiling, or any risk for any kind of infection or unknown medical diagnosis. So the first step for implementation is if that we are wearing long sleeves, we must roll it up to our elbows and then remove any kinds of jewelries like bracelets, watches, and then the next would be we will check our nails. We will get a nail file and then file it until it gets short and smooth. Next is stand in front of the sink, maintain a little distance, make sure that your top wouldn't touch any part of the sink to maintain cleanliness. So if your faucet is hand operated, we will use the elbows. If it is knee operated, we will use the knees. If it is foot operated, we will step on it. And if it is infrared operated, it has a sensor that detects if our hand is there, it will automatically turn on. So for this, since it is hand operated, we will use our elbows to turn it on. Then we will wet our hands thoroughly. Make sure that your arms is always higher than your hands. So next is we will get the soap. If it is liquid, we will use 2 to 4 ml, and if it is solid, we will rub it against our palms. Usually, medical hand washing lasts as long as the happy birthday song. But for now, we'll make it short. Rub your palms. Steer your part as well. Interlace your fingers at the back of the thumb. Each finger. Do it both in the right and in the left. Rub your fingertips in the palm. Soap your wrists. Continue for 10 seconds and then wash the hands. We will turn it off. Use a clean towel to wipe your hands and then use the other part for the other hand. So when it comes to surgical hand washing, we must assess our fingernails first. We should check if they are short and clean. The next will be our hands and arms, if there are any types of cuts, lesions, or abrasions. Next is our scrub suit. The top should be tucked in the waist of the pants. And then watches, rings, or bracelets should also be removed. But when it comes to masks, eye equipment, and cap, it could be worn while doing the surgical hand washing. This surgical hand washing is done so we could prevent any kind of disease or any kind of germs that can be passed from one client to another. So in proceeding with hand washing, we will turn on the faucet. When it is hand automated, we will use our elbows to prevent the spread of bacteria. Next is we will wet our hands up to our elbows, 2 inches above our elbows. and add soap. And then rinse. So after cleaning our nail bed with a file, we will get a brush and then add some antimicrobial detergent, and then we will use that to scrub our fingers, palm, arms, and elbows. So let's pretend that this will be our brush. We will brush our fingernails 15 strokes each. For our palm, the posterior part, and then the fingers, it will be brushed 10 strokes each. And then we will mentally divide our arms into 3, scrub it in a circular motion, and then we will discard the brush that we used. And then we will rinse thoroughly. After rinsing, we will turn off the faucet again using the elbow. We will hold our arms upward so that the water will drip in our elbows. And then bend slightly forward to dry our arms in a sterile towel.